to collaborate in development of unique and new formulation which will help to control critical diseases. John is continuously organizing the webinars on immunity booster products. Dr. R.S. Reddy, 7 times Peace Prize nominee and chairman and president of International Media and Culture and American Dairy and Food Consulting Lab, USA, is with us and who will educate us about the ionized milk mineral complex and how it is positively effective to all the ages, especially in the pandemic of COVID-19. We also have with us Mr. Siddharth Reddy, founder and CEO of GLN Labs, and Dr. Anish Desai, director of Incurred Healthcare, who will elaborate this subject to us in today's discussions. I once again thankful to all pharma and nutra companies, doctors, researchers, and our partners, national and international level, for attending today's webinar. Wishing you all a healthy life. Thank you very much.
Thank you, Sureshji. You are always a man of few words, a man of simple thoughts. That's what I call it, a man with passion, and as I said, with perseverance. And you always keep it short and very simple. Thank you so much. Now, dear my friends and colleagues, I'm going to really bring this dynamic personality in a way. I would like to read out his background, which is such a very elaborate background, such an intense and extensive inventor. No, it's my privilege today to introduce him on this occasion and to enlighten the thoughts process on the ionized mineral complex. Dr. Reddy, an inventor who is a doctorate in veterinary medicine, food technology, and microbiology. He is 7-time Nobel Peace Prize nominee. Received MS and PhD degree from Iowa State University, USA, with honors and distinction. He is the chairman and president of International Media and Cultures, American Dairy and Food Consulting Laboratories, manufacturer of cheese and dairy microbiological cultures, probiotics, satellite biological and biological chemical systems, which go into the American and European dairy products, manufacturing, huge presence in the American and European cheese markets with 12 manufacturing plants across 8 states in USA. He is the life member of the American Association of Physicians of Indian origin, affiliated with American Medical Association. Dr. Reddy holds over 150 international patents, published over 100 scientific papers, has written 3 books, and served as a consultant for over 70 national and international companies. That's something which is excellent. Coming to much deeper insights about Dr. Reddy, who is recognized worldwide and received over 140 honors and awards. Richard M. Hoyt Memorial Award, an only Indian or foreign-born citizen to receive this prestigious award of Six Sigma Research Award, Best Medical Research Award at the 68th Indian Pharmaceutical Congress for the discovery of novel multiple mixed strain probiotic therapy in 2016. Pride of India Award in 2012. Outstanding Scientist Award for IAFC Washington, D.C., presented by former Prime Minister of India, Honorable P.V. Narasimha Rao. Prestigious US President Ronald Reagan Gold Medal Award from US Vice President, Honorable Dick Cheney, Entrepreneur of the Year Award in '96. Bharat Gaurav Award from former Prime Minister of India, Honorable I.K. Gujral. Hind Ratan Award from the former Prime Minister of India, Honorable I.K. Gujral. Received 3 Lifetime Achievement Awards for his research efforts, which have contributed to the welfare of the humanity and world economy. His inventions contributed over $1 trillion towards world economy. Serves on the committee of the Complementary Alternative Medicine Division of AAP, American Association of Physicians of Indian origin, the largest professional medical association. I once again welcome Dr. Reddy, Dr. M.S. Reddy, who is an inventor, a dynamic, a passionate personality in the sector of healthcare and the food industry. Dr. Reddy, we really graciously welcome you, and I'm really privileged and thankful to you to be present here on behalf of Xeon Life Sciences to enlighten today's August audiences. Thank you so much, Dr. Reddy, to come here. We welcome you to grace this occasion with your super knowledge, wisdom, experience, and expertise in the area of the food industry. Thank you. Dr. Reddy?
Yes, I'm on. Could you all see me? Then I want to take this opportunity. It's an excellent job, Sandeep. With an introduction like that, I better live up to your expectation in this presentation. And I want to invite all the participants, and also this is my privilege to be invited to give this talk, and I'll try my best to explain it as simplest way as I can in this webinar. And also I want to take this opportunity to wish the best for all the people in India and all over the world from this COVID-19 disease that's going around. And my message is nothing to panic about it. I think as Mr. Suresh Garg said, immunity is the name of the game. And then anyway, with that, I'll start today's presentation. As Sandeep Gupta beautifully summarized what I'm going to do, okay? I'll try to live up to your expectation, right? Okay. Now let's talk about that. I'm going to take it to a simplified way because I'm not going to assume that everybody know about calcium, because let's start from the basics, then we go into the specifics. First thing, what is calcium? What is calcium? What is this deal about? As Sandeep said, this is a golden metal. It is a vital thing for the human being. Calcium cannot be synthesized in the human body. You gotta eat it, period. No other way, okay? It's like an essential amino acid. It has to be supplemented, number one. This calcium is a divalent cation, okay? Don't worry about that name. 99% of the calcium in the body stays in the bones and the teeth. That rest of the 1% is in the blood, okay? In that 1% calcium is going to, again, that 1% calcium, out of that, 35 to 50% of that is ionized calcium in the blood. Ionized means it is not sticking with the protein. It's by itself, okay? And another 35% of that is non-ionic. Non-ionic means it is bound to the proteins like albumin and the globulins in the blood. And the rest of that 15% or 20% is in the form of salts, like calcium phosphate, like that in the blood. They're diffusible, okay? So that gives you an idea where the distribution of the calcium is in the blood. See, what does this calcium do? What does this calcium do? Calcium is the one that controls our central nervous system, gastrointestinal functions, blood circulation systems, as well as muscular systems, what have you, because it is involved in various actions in the body, specifically even the hormones, as well as the enzymatic systems all over the body. It will participate in more than 100, maybe perhaps 1,000, okay, reactions in the body to help these systems go on, both intercellularly as well as extracellularly. That gives you an idea what we're talking about, okay? The second thing I would like to introduce, what is this bioavailable calcium? Everybody talks about the bioavailable calcium. What does it mean? Bioavailable calcium means if I give 1,000 milligrams in a diet, if all 1,000 milligrams get into the blood and then gets deposited in the bones, it is called 100% bioavailable. Okay, that gives the definition. If I say 70% bioavailable, means out of the 100 milligrams I gave, only 70 milligrams got in, 30 went out in feces or what have you, in the urine and all that, okay? That's what is the bioavailable definition is. And then not all calciums on the market are bioavailable. I want you to know that, because a lot of people get misinterpreted with this bioavailable calcium. The next thing I want to talk about, you all hear this word RDA, recommended daily allowance. Who does this? This is done by WHO, World Health Organization, sets up the standards and then say, hey, this much calcium we got to eat every day. That is what recommended daily allowance. The recommended daily allowance right now in the world is 1,000 milligrams to 1,200 milligrams per day. Okay. Now, again, each country it varies again. In America, they will say this USRDA. That means United States recommended daily allowance. India, it could be different. Okay. It depends on our nutritional habits and what have you. And that's what is RDA. The current RDA for the calcium is 1,000 to 1,200 milligrams per day. But again, they are not talking about bioavailable calcium here. That is the catch. They're only talking about elemental calcium. That doesn't mean that is bioavailable. Even on RDA, there's a mistake with this because they're not taking into account the bioavailability. That is what the subject is going to be, we'll be discussing. That's why I want to bring up the RDA, okay? Now, what are the major diseases due to lack of calcium? If calcium is not absorbed into the body, what's going to happen to us? There are two diseases. There are two diseases that are prominent in this thing. Again, Sandeep Gupta always want to talk about this sarcopenia. Sarcopenia is loss of muscle, but I'm not going to concentrate on that right now. But I'm going to talk about calcium deficiency. There are two types of silent diseases we have. One is osteoporosis. Another one is osteopenia. Osteoporosis and osteopenia. What does it mean? That means when the calcium absorption is less, when there's less calcium in the blood, then we need it for actions. The calcium is pulled out of the bones. When once it's pulled out of the bones, the bone gets weaker. Okay, that is why the definition of osteoporosis, according to the WHO, is the bone mineral density, which is 2.5 standard deviations below the peak bone mass, measured by the DXA. Okay. Yeah, that is energy X-ray, dual energy X-ray absorptiometry. Don't worry about the definition. I'll simplify it. What it means is, when you're 20 years old, in a 20 years old, male or female, you look into the bone mineral density, and then they look at their bone density. Okay, that is the highest you're ever going to get in your life. Okay, that is the standard. Okay, when somebody has osteoporosis, that means 2.5 times standard deviation means that much less compared to the 20 years old bone strength. That's all it is. Okay, that is the standard. Standard is 20 years old bone density. Okay, that's what is osteoporosis. Osteopenia means 1.5 times standard deviation below the peak bone mass of the age 20. Okay, osteopenia and osteoporosis, believe me or not, I'll tell you, 1/3 of the world, 2.3 billion people in the world either have osteopenia or osteoporosis. These are silent diseases. You will not feel it, but one day you will realize you have a fractured bone or you have fractured wrist, and then all other things will come on, okay? Now let's talk about when I have the osteoporosis, well, how do you know about that? How do I know that I have osteoporosis? The symptoms of osteoporosis are the joint pains, because you will have an abnormal pain in the joints, and insomnia, not sleeping right, hair loss, which a lot of people know, muscle spasms, obesity, fatigue, and dental problems, and immature aging. There are some people out there, they're only age 30, but they look like they're 80 years old. Yeah, turn around. There could be an 80 years old guy looking like a 30 years old guy with a good calcium in the body. And nervousness and weak nails, etc., etc., etc. These are all the symptoms of calcium deficiency. The biggest thing that's shown in osteoporosis is the bone fractures, okay? Now let's talk about simple things like this. Well, how does this calcium get absorbed in the body? Yeah, go back to the previous slide. Show that human gastrointestinal tract in the slide. Okay, anyway, how does calcium get absorbed in the body? Okay, when we eat calcium, let's say either in the form, yeah, there you go, thank you. When you eat the calcium, either in the food or as a supplement or what have you, this calcium goes into the stomach, it gets ionized, if you have the proper hydrochloric acid in the stomach, and in that ionized condition, this calcium, when it leaves the stomach, it goes into the duodenum, in the proximal part of the intestinal tract. In the duodenum, it goes through active transcellular transport system. What does it mean? Don't worry about the name. Active transcellular transport system. That means this calcium actively gets through the enterocyte. Okay, it has to be drawn in. That's where you need the vitamin D, magnesium, and phosphorus to help the calcium to get into that. 90% of the calcium get through this active route, active transcellular passport. Then if you miss that, the rest of the calcium goes into the ileum, into the distal part of the intestinal tract, and then it goes through paracellular transport system. That means it's a very inefficient way of doing it, but at least body tried to pick it up right there. And if there's any leftover, you can pick it up in the colon. That's why the body, the calcium gets absorbed in the body in a simplified terms. Okay, the next question. What is the age, race, and other factors affecting the calcium absorption? Okay, naturally, old age. In old age, as we age, the calcium absorption gets less. Even there is data indicating right now, even for the woman, even at the age of 30, 35, anytime we cross over 25, they will only start losing the calcium. Okay, absorption get less and less and less. This is the God's creation. God created in such a way that as we age, calcium should not get into the body, and you should start looking older and you should die. I mean, this is the population control by God. But as a scientist, we can understand, as Albert Einstein said, don't go against the nature, but try to work with the nature. So what we are trying to do, hey, how could we delay the process so that people don't have to look old, people don't have to get disease. That's what that is. So age, as we age, the calcium absorption get less. And even on the, as I said earlier, bone peak bone mass at the age of 20. That means when you're young, you should take the calcium too to develop that bone strength at the age of 20. If you have good bone strength at the age of 20, even if you get into 60 and older, still you will not lose the calcium. This is the trick in it. That is why all age groups have to take this. That is why I was telling age effect. Let's talk about the race effect. In the race, if you take the Caucasians and also the North American Anglo-Saxon descent, white female, Caucasian female, and they have more chances to develop osteoporosis. Somehow calcium doesn't get in. Specifically, in the female after the menopause, 1 in 3 women in the world after menopause develop either osteoporosis or osteopenia. Okay, that is a known statistic right now. Okay, and then what other things? And then let's talk about smoking, alcohol, diseases. All of these factors contribute to the lack of absorption of the calcium. Calcium doesn't get into the body because of other factors to doing it. And then let's talk about age, the sex effect. Okay, in the female, when they have the estrogen, okay, when they're young, you have the estrogen hormone. That's a female hormone. This female hormone is the one that controls the hydrochloric acid production in the stomach, because your stomach acid production is controlled by the hormone especially in the female. So as they age, when the estrogen levels start coming down, let's say somebody got married and then they eventually when they get children and all that, this estrogen hormone starts coming down because the desire for the sex is less or what have you. And then when the estrogen hormone comes less, the hydrochloric acid in the stomach gets reduced. When the stomach hydrochloric acid is reduced, your calcium doesn't ionize. When calcium doesn't ionize, it doesn't go to the active transport system. When it doesn't go to the active transport system, that means 90% of the calcium is cut out, okay? So that's why women start developing the weaker bones and they start looking a little aged as they go, 30, 35, 40. If you look at the woman at 20 versus 30, 35, 40, you will see the difference. This is because of the calcium absorption, which is linked to the estrogen. Let's talk about the male. In male, you have testosterone. Okay, eventually, the testosterone start dropping. This is called andropause. At certain in the men, it comes a little later, okay, than the females. and the testosterone production comes down, then testosterone gets converted to estrogen. That naturally, again, the stomach acid is low. When the stomach acid is low, calcium doesn't ionize. Then you have a problem with calcium absorption being shot, both in the active transport system. Only thing left for you is a little that passive transport system, which is only 10% effective, not 90% effective as active. So consequently, this is what I was talking about. With old age, you got to take the calcium. In your young age, you got to take the calcium. Calcium is universal, irrespective of the age group. You have to be supplementing it. As I told you, you have to eat the calcium. Your body cannot synthesize this. It can only way it's going to draw the calcium off the bones, then it creates osteoporosis again. Okay, that's how the age, race, and other factors control. Okay, benefits of eating good calcium. If you have a good calcium level in the body, you will have less hypertension, especially blood pressure. Blood pressure is the biggest problem in the world right now. Diabetes and the hypertension. And these are the chronic things that are bothering all over the world. Okay, the hypertension is linked to the low calcium. When you have the calcium level, bioavailable calcium and all that, you will not have that much hypertension. Cholesterol reduction. Triglycerides can be reduced. Obesity right now. If you take the America, we have 70% obesity. Okay, people are heavy. It's obesity is because of the calcium, reduction of calcium in the body. Okay, colon cancer. It has been proven that some of this calcium reduces the colon cancer. Okay. So how do we control all this? The answer to all this is using bioavailable milk mineral complex. That's what we're going to talk about today. Okay. And then now I'll be discussing a little bit about one more subject, which I could take it up later in the question session. A lot of people ask something: how, why would I? What is this bioavailable milk mineral complex? Or how is it different than the calcium carbonate? Calcium carbonate is a cheaper ingredient. A lot of people like to use the calcium carbonate. What did I tell you? Calcium is taken because you have less calcium in the body. Why is less calcium in the body to start out? Why is this? Because your hydrochloric acid or your hormonal control is shot and your hydrochloric acid is less. If the hydrochloric acid is less, calcium carbonate is not going to ionize. It needs a lot of acid to ionize that. So if it doesn't, that calcium carbonate is not going to get into the active transport. Guess what? Rather than helping as a calcium supplement, it acts as a buffer. It has a buffer as a neutralizer. So in the ileum, the distal intestinal tract, you need to maintain pH 5.2 to 5.3, perhaps 5.1. This calcium carbonate will neutralize it. It stops even that passive transport system. Consequently, rather than helping the bone, it goes other way around. Because as I indicated earlier, age has a lot of factors in it. This is why if I could give you a calcium that's already ionized, that's already made bioavailable, irrespective of acid in the stomach, then we will override this problem. Okay? Then that way we are going against the thinking of God. Okay, you don't have to look old. If you keep taking it, you have less diseases, less problem, and it works as an anti-aging ingredient. That is what that is, calcium carbonate. Another question has been raised all along. The New Zealand people and all these people are bringing milk calcium. How is that different than this milk mineral bioavailable complex which you are talking about? How is it different? The milk mineral they're bringing in is not made bioavailable. It's only extracted off the milk through centrifugation, but they were not chelated or ionized. This is the difference between that. Plus, we're using probiotics to make this compound come out better. This is where I want to give you just the basics of it. Now we can go to the slide presentation. Now it makes it very easy for you. You see that calcium absorption there. You see the in the stomach it ionizes, and then the duodenum it gets in there. That's the active transport system where 90% of the calcium get absorbed, and then whatever is coming down in the ileum through the passive transport system, that calcium gets in, which is a very inefficient way of doing it. As we age, active transport system gets shot, because you don't have much acid in the stomach, and you only rely on the passive transport system, which is linked to the probiotics. So we took care of that problem too. So we have created in a different system in here, okay? Next slide. Next slide.
Next slide. Next, please.
Could you move it? Yeah, there you go. Product profile. In this milk mineral complex, what we're talking today, 30%, there's 30% elemental calcium. What is elemental calcium? And then this is another issue what the people have to talk about. When you talk about calcium carbonate, you have 40% elemental calcium. Calcium citrate has 20% elemental calcium. So calcium, it doesn't exist freely in the nature. It got to be in the form of salt. So that's why elemental calcium is the amount of really calcium divalent ion that's going to be derived off that product. So you get 30%. Its similar composition is human bone structure, and the milk-based calcium, mineral, and peptides. Let's talk about the peptides. What are these? Peptides, if we take the protein, milk protein is casein. It could be vegetable protein. It could be any protein. We take the protein. Protein is made of amino acids. Okay. The peptide is when you start chopping the protein by peptidase enzymes or protease enzymes and aminopeptidases. When you use these enzymes are present in the gastrointestinal tract in the human body, you know, and then these peptides are the broken down products of protein. So the peptides coming off the milk, specifically those peptides, they all have a specific function in the body, which is those peptides are inhibitory. Some of these peptides are inhibitory to the angiotensin producing enzymes. Angiotensin producing enzyme is shot with these peptides because of that, the calcium and also these peptides, they reduce that angiotensin converting enzyme. Consequently, you're not going to have cardiac diseases. Okay, that's obesity too. Obesity is linked because of these peptides and the calcium together in the milk mineral complex, that's what we have in our system. Okay, if you take the other the milk derived calcium or something like that, the centrifugation, you're eliminating those peptides. We have the peptides in here is coming from the milk origin. Okay, next one is present in nano-sized particles. What does nano-sized particle means? A nanometer is 1 billionth of a meter. If we take the entire world like a globe, and then the entire world, and then you see a little pebble in the world, little pebble is nanometer. Okay, a little.
Next slide.
You can imagine how small it is. Okay, and then so nano-sized particles, because in this particular preparation, what we made with the milk mineral bioavailable complex, the particles have been nano-sized. Nano-sized means it has been reduced so low, small things. That way the absorption could be very good in the system, in the human system. And then another one are pre-ionized and chelated. Pre-ionized and chelated. What does that mean? Pre-ionized means releasing the calcium. Chelation. Such a calcium, if I tag on with an organic compound, for example, citric acid, calcium citrate is a chelated product. Calcium lactate is a chelated product. Calcium maleate is a chelated product. These chelated products, pre-ionized products is by elemental calcium, and the chelated product is soluble and it gets through the active transport system. Furthermore, even if you miss there, you go into the ileum, and these chelated compounds can be further broken down by the probiotic bacteria or the microbiota in the gastrointestinal tract, and then releases that elemental calcium to get into the blood. Okay, that's what is pre-ionized and chelated. All these functions have been, their product profile is in the milk mineral bioavailable complex. Next one. Then it shows, as I indicated earlier, calcium carbonate 40%, milk calcium complex has 30%, calcium citrate has 21%. Like that, every salt has different elemental composition. Next slide. Full spectrum. This is a beautiful, beautiful concept. Concept here is when we are taking this milk mineral complex. In the milk mineral complex, don't think, as even Mr. Sandeep Gupta said, the calcium is the golden metal. It's true. Well, next to golden metal is what? Silver, platinum, palladium, all those, right? Same thing here. Calcium alone is not the answer here in our body. Calcium is the main thing. You have magnesium, phosphorus, potassium, trace minerals like iron, copper, zinc, chromium, manganese, molybdenum, selenium, on and on and on. There are so many major minerals and minor minerals. Okay, these minerals play equally important role, okay, in the human body. So in our milk mineral complex, we made sure they are also bioavailable. This is the beauty with this product. I can stress that fact because there's nothing available in the anywhere in the world right now where all the minerals, major as well as minor, along with the calcium, are made into bioavailable minerals, which is why in your health, even if you are missing like say selenium or copper or zinc, then it shows up like some other disease. Okay, in other words, this complex has a tremendous functionality to supply all the bioavailable minerals to the body, irrespective of the age group. Okay, and also dairy-related peptides and amino acids. When, as I indicated earlier, dairy-related peptides and amino acid protein breakdown products coming off the milk in a specific way done, along with combination with calcium, have a tendency to reduce adiposity. I can also add one more thing right now, as Mr. Garg was telling earlier. COVID-19, we are working on it. COVID-19, the secondary effect of it is thrombosis. That means the blood clots in the blood forming. This milk mineral bioavailable calcium complex will reduce the thrombosis, even in the COVID-19 disease, because this has a tendency to stop the angiotensin II production. Angiotensin II is the one that's causing inflammation in the blood vessels, and also that is the one that induces oxidation and thus causing thrombosis, because the virus, coronavirus, is attacking the ACE2 receptor site, which is shut. Even though ACE2 is taken out, this milk mineral complex, along with the peptides, is overriding that factor by cutting the amount of ACE2 production. Okay, this is a little complex, but I just want to touch base on it. If anybody has question on that, I will elaborate later. But that is, I'm telling you, this is one of the ways to control the COVID-19 disease, secondary effect. Okay, minerals from milk source have many roles in the body, including enzyme functions, bone formation, water balance, and oxygen transport. Okay, which is I have already touched base before that. Okay. And then the same thing, proteins are broken down to smaller peptides. So in this particular complex, we are also breaking the protein, not only the protein, we are also breaking the lactose. People are allergic to the lactose intolerance is there. It's not, lactose intolerance is different than allergy. Lactose intolerance is some people lack the enzyme in the body, so they cannot have milk because this enzyme is present in the ileum. It breaks the lactose to glucose and galactose. If they don't have the enzyme, they have a problem. But in this particular milk mineral complex, we made sure there's no lactose left. We hydrolyzed it. Okay, that's another beautiful factor in this thing. And we hydrolyze the proteins using proteases to bring it down to the amino acid condition where these amino acids and peptides, these peptides specifically, will go against the obesity. Now, in the modern thing right now, COVID-19. COVID-19 can be controlled using this, that secondary thrombosis, okay, or the blood clots forming. In Italy, they found us postmortem. Most of the people who died have the coagulated blood and blood clots. Okay, next one. Okay, well, it's the same thing. Since it's drawn from the milk, it is similar to the human bone, milk, and milk complex matches with all of those things. This is all natural way of doing it. Next one. Unique process. Why don't you go into the unique process? I can explain to you right now. Where we did this, you're all familiar with the probiotics. Probiotics is a hot subject in the world right now. Probiotic is a simple thing. Probiotic is when the human being came into existence, let's say a billion years ago, whatever, we don't know, okay? At least I was not born billion years ago, okay? Let me put that way. Billion years ago, when when the life was starting, along with the civilization of the human being as they evolved in the ancestral time, human being also picked up some bacteria in the gastrointestinal tract, okay? In human body, we have 100 trillion bacteria in the gastrointestinal tract, whereas human cells are only 10 trillion. That means we are made of more bacteria than our own cells. In those that is called microbiota. Microbiota means the total number of bacteria you have in your GI tract. There are 100 trillion, okay? Now, in that 100 trillion, at least 20% of them are probiotics. What are probiotics? Probiotics, they have a therapeutic effect in the body, okay? They control a lot of functions in our body. If I take the probiotics out of the microbiota, you're not going to live more than 3 days, okay? That much role they have. And these probiotics are the ones that reduce your cholesterol, that reduce your triglycerides, reduce the cancer, reduce on and on and on functions they have, okay? These probiotics, so what we did in our system, milk mineral complex, we fermented those minerals and the bases using the probiotic. I mean, these probiotics will convert all of that to break it down and produce nano compounds as well as immunomodulins. Immunomodulins is, as Mr. Gord said earlier, the name of the game right now is to develop the immunity. These are the factors that improve your immunity that has been built into this system already, okay? Now, spray drying used on nanotechnology. What does that mean? That means after we digest it with enzymes, after we ferment it with the probiotics, we take those minerals, and then what we are doing, we are spray drying using tungsten nozzles, and then make the particles so small to induce like a nanotechnology. Nano means less than 100 nanometers. Most of the particles are less than 100 nanometers in this thing. And then I wouldn't say 100% nanotechnology, but bring it to the point that is assimilable better. Next one, next slide. Production flow chart, I don't think you'll be interested in it that much. It looks too complicated. It's a very simple thing. Okay, you take the milk and you take the proteins out of the milk. You get all the minerals that are in the milk, and then you concentrate those minerals. And then what we we ferment them and we enzyme hydrolyze them to reduce the lactose, to break the protein down. The protein, some people are allergic to milk protein. So what we have used is protease enzymes and also both the acid proteases and alkaline proteases to break the protein so that it will be non-allergenic or hypoallergenic. We took care of that, and then we fermented it, we concentrated it, and then we spray dried them, and that is the product. So the product finally end up with protein breakdown products of the milk origin, and also chelated compounds and soluble calcium. And then some fractions may not be soluble, most of them is soluble, and that is what is bioavailable milk calcium complex. It's a beautiful name, okay? Next. We talked about the nanosized particles because I explained to you already. A nanoparticle is 1 billionth of a meter, and then it's a tiny, tiny, tiny. To be called nanotechnology, the particle size should be less than 100 nanometers, okay? That is the modern standard right now. Next one. Pre-ionization. Pre-ionization, I already explained to you. Ionization means calcium that is not tagged onto the protein, okay? That's what is ionized calcium means, unbound calcium, okay? In our preparation, we made sure it's pre-ionized and also it's chelated, okay? That is why I already explained to you about that. This is the reason I wanted to explain to you earlier to bring it to the point where you can follow these things. Next one. Chelation. Chelation also I explained to you earlier. Chelation is while making our process, we converted some of this calcium to various salts. Okay, everybody says, hey, take calcium citrate or take calcium carbonate. I told you, chelation means what we believe in this process, we not only have calcium citrate, calcium malate, calcium gluconate, calcium lactate, calcium acetate, all of these various chelated calcium compounds, because in the human body, it's not only one kind of chelated calcium gets in. It is a mixture of that. It's a multiple mix. That's what is in this thing. So that is where the efficiency is 100% effective in this. That's what is chelation. Chelation means calcium attached to an organic compound to form into calcium salt, soluble calcium salt. Okay, calcium carbonate is not soluble. These chelated compounds we have in the milk mineral complex are soluble, that they can get through the active transport system as well as the passive transport system, and then supply the adequate amount of calcium irrespective of the age, irrespective of the menopause, irrespective of your condition in the body. Okay, a lot of diseases, even if you have it, this is the route to push the calcium into it, because calcium controls how you look. And I can add one more thing. Anti-aging. Why would people look different as they age? As they age, they droop, and then they bend, and then all kinds of things. The looks go away. Looks, if you look at a 20 years man or woman compared to the 40, 50, 60, 70, 80, you see that old age effect. This old age effect is because the calcium is not getting in. When once your calcium go down, and alveolar bone goes down, and then the muscle also is going to go down. That's where the Sandeep Gupta was talking about sarcopenia. Then this starts all related. The sarcopenia and the osteoporosis, osteopenia, reduction of the calcium is what makes you look old. If you take care of this properly, this milk calcium, you look young, active, skin looks beautiful. This is a one way of causing anti-aging. Okay, anti-aging means good health. That's all it is. If you're in good health, you look good. That's what is next one. Conclusion. Not all calcium supplements available in the market are bioavailable. By now, you all know that. Okay, as I said, calcium carbonate is the cheapest ingredient, but it has, the reason you take calcium is because calcium is not getting into the body. Why is it not getting in? Because it's not getting ionized in the stomach. So if you take the calcium carbonate, already you don't have acid in it. It's not going to ionize. It's not going to get absorbed. Then it acts as a buffer to do more damage, causing constipation and all these things. That is why calcium carbonate is out. And then if you take the milk mineral complexes, which the people are selling, they come from New Zealand and Australia and all into India. If you take that, they're not made bioavailable. They're pulled off the milk. I understand that. It's the milk mineral that came in. But in this particular process, we made him more bioavailable. This is what is conversion to the soluble calcium compounds. Okay, and also having the broken down peptides, and also the immunomodulants coming off the fermentation due to probiotic bacteria. It's a beautiful system and a beautiful product, and this is what I strongly recommend. And also in this COVID-19 period, this is one of the answers to stop that secondary infection. With the COVID, two kinds. One is lung shot, because secondary effect is the virus is getting into the blood. This is where this calcium could help. Next, that is it.
Yeah. So thank you so much, Dr. Reddy, for your excellent insight. What we draw from you, this milk mineral complex, ionized mineral complex, is uniquely processed, is differentiated from all the conventional calcium, and more importantly, it is available in an ionized, in a nano size and a chelated form, which makes it very different from the market and makes it more bioavailable and more absorbable calcium, which is absorbed intracellularly and extracellularly. Interesting insights. I think the audience might have enlightened with this uniquely placed, differentiated, ionized mineral complex, which we call as a golden mineral. You have a lot to talk about as an unique selling propositions for your brand in the market when you take this product from Zeon. Now I come to another dynamic speaker who comes with a strong accolades in the industry, a trained clinical pharmacologist and a pharmaceutical physician with 3 decades of experience in academia, research, and healthcare. Dr. Anish Desai, I graciously welcome on this occasion of ionized mineral complex subject. He is also a chief expert scientific advocacy board of the Expert Nutraceutical Advocacy Council, called as ENAC. He comes with 30 years of experience working with large organizations of Indian and multinational organizations like Johnson & Johnson, Bayer, Schering Pharma, Glenmark, and Unichem. His expertise in R&D is an entrepreneur spirit and innovative ideas have successfully generated sustainable revenue for several organizations. Dr. Anish Desai has been a board member of several organizations making business decisions for portfolio introductions, product and service strategy. He's achieved and strategic excellence and execute as well as develop ideas for new growth opportunities at the management board level. Dr. Anish Desai has therapeutic expertise in the area of diabetes, cardiometabolic, oncology, dermatology, infectious disease, women's healthcare, pediatric and metabolic surgery, orthopedics and trauma, wound management, and minimally access surgeries. With an extensive experience in the field of research, Dr. Anish Desai has published and presented international and Indian peer-reviewed journals and conferences with nearly 130 publications and abstracts. His most significant contributions to the field include registering and launching near 50 molecules for the first time in India across therapeutic areas. Dr. Anish Desai has also worked in drug development and NC research with 2 molecules in phase 2 clinical trial. Dr. Anish Desai has been a reputable member of revered organizations such as American College of Clinical Pharmacology, USA, Royal Society of Medicine, Society of Pharmaceutical Medicine, Clinical Research of Professional USA, a technical faculty at a CLIM institution in Maharashtra University of Health Sciences, KM Hospital, a very famous the medical college called as St. George, NMIS School of Pharmacy, Pune University, and CB Patel Research, and KM Kundani College of Pharmacy. Dr. Anish Desai is a recipient of prestigious Charles R. Ream Award of Excellence and Yukesh Sheth Award for his stupendous work in the area of research at KM Hospital. Thank you so much, Dr. Anish, to be present here. Your wisdom is always important, and combining with an wisdom on expertise of Dr. Reddy, you make it a really deadly combination for the subject matter, ionized mineral complex. I hand over to Dr. Anish Desai. Please take over.
Thank you, Sandeep, for the kind introduction. At the outset, I would like to thank Mr. Garg and Zion Life Sciences for inviting me again to share the dais with an illustrious personality like Dr. Reddy. In fact, I have an unenviable task at this point of time to match Dr. Reddy, and I don't think I'm going to try and do that. I'll just try to make a small presentation in terms of how do I really supplement to what Dr. Reddy spoke of. In fact, following up with Dr. Reddy is like following up on a cricket field after Sachin Tendulkar or Virat Kohli has set the pace for it. And it's going to be a very challenging task for me, but I'll try to come up to that task. So coming to the basics of the bone, I think one of the most important points to note that the composition of bone is very unique. The composition of minerals in the bone is also very unique. And if you'll see here, 99% of calcium is stored, of the body is stored in bone and teeth, as it was mentioned. 99, and along with the calcium, there are other salts which are there, which are potassium, sodium, magnesium, carbonate, phosphates. So this is a very important aspect to notice what exactly is the composition of the bone. And why am I stressing on this point? Because Dr. Reddy mentioned about the entire milk mineral complex in terms of its composition. So we need to see that how do we really match the composition of the bone with the supplementation of calcium and the other minerals that we are giving. And that's the reason is the importance of this slide, to show that what we are talking of is the ionized milk mineral complex is also similar to the composition of the bone. So that's the most important message that I want to give through this slide. Next slide, please. Dr. Reddy spoke a lot about calcium deficiency, calcium intake, and osteoporosis, osteopenia. And one of the things that I like to highlight here, that if we look at Indian population, compared to the RDA, which is nearly 1000 to 1200 milligrams, the intake of calcium is only 300 to 500 milligrams per day from the ideal daily intake. And that leads to a lot of calcium deficiency. As had been mentioned, calcium is the most important mineral in our body. It is responsible for neurotransmitters. It is responsible for certain kinds of cardiovascular regulations. It's also responsible for several other complexes which are there. And therefore, calcium becomes an important part of it. But the manifested situation that we see with calcium deficiency is something which is weakening of the bones. And the weakening of the bones results into something called as osteoporosis. And that is one of the things, and why I want to highlight on osteoporosis and why I want to highlight on this disease is that if we go to the next slide. Here, what I want to show is what exactly is the percentage of osteoporosis in different populations. These are certain studies. So what I would like to come out here is with the data that has been presented in several journals, the data which is talking about the incidence of osteoporosis in different age groups related to spine and hip surgeries that are responsible for it, the kind of osteoporosis that is prevalent in male population as well as in female population. So that's a very important aspect of these. The amount of people who suffer in India with osteoporosis is very large, and that's a very important because this is a debilitating disease. We may think very simply that what is it? It's just the weakening of the bones. However, that's not the case. The weakening of the bones can actually lead to fractures, and these fractures can actually lead to a lot of the burden on the society which we are talking of it in terms of the numbers, in terms of the cost. It also leads to a lot of economic and loss of quality of life, or the DALIs as we call it in the health economic space. So osteoporosis being one of the most important aspects of calcium deficiency. In fact, one point I would like to, next slide please. So again, this is what I said, that the cost of osteoporosis is not only on the treatment, it's also on the diagnosis in terms of the DEXA scans, which Dr. Reddy was talking of, and also it's treatment. One of the major challenges in India is that most of our patients are uninsured. It's out-of-pocket payment. And even the 40-50% of increase in insurance that has happened through the Ayushman Bharat also is related to the cost which the government incurs. And therefore, when you look at it, there is a cost which is incurred by the public health as well as the private health. So the cost of this disease, which is because of a simple mineral that can be supplemented effectively, is very large for the society, for the individual, as well as for the healthcare system. And when we look at the healthcare burden today, we need to decrease this healthcare burden in such a manner so that we can use the available resources in different areas and where it is required. If we go to the next slide, please. One of the important things is that the risk of osteoporosis is very high in postmenopausal women, in elderly men, but the osteoporosis or deficiency in calcium can occur at all ages. If you look at so calcium is a mineral which is required from, say, the cradle to the advanced age, and therefore what I say is that calcium deficiency or requirement is not only in the older postmenopausal women or men, but it is also important. The calcium as a supplementation is important in childhood, in infancy, as the child is growing, when the bones are being formed, because during that age, if calcium supplementation and adequate calcium is not there, that can lead to weak bones. These weak bones later on can translate into osteoporosis and much weaker bones. There has been some studies which I do not have the references as of now, but I remember them seeing that if your bones are, and as Dr. Reddy mentioned that, if your bones are stronger during the developmental phase, your chances of osteoporosis and other bone diseases are much lower in the later age groups. And that's where we need to look at it, that we need to look at calcium not only as a supplementation for osteoporosis, for fractures, but also at all age groups. Even in the adolescents, calcium is very important in these kinds of patients, or not patients, but growing adults. We see a lot of youth today going to the gyms, trying to build their body, and calcium becomes an important part of supplementation along with the other kind of protein supplements they take. Next slide, please. Again, this is something what I want to put it here, highlight, is that prevention is better than cure. So prevention can happen. So osteoporosis, though it's a debilitating disease, which can lead to a lot of clinical and economic consequences, it is preventable. and preventable by very, very simple, small supplementation of calcium, which is available in abundance in the nature and which has been recommended. So therefore, what in next few slides, I would just like to highlight the importance of calcium supplementation, the importance of this ionized milk mineral complex that we have talked of it, in terms of its clinical efficacies, in terms of its clinical benefits, and how a small, simple formulation can help us to take in a composition which is there from the bone. So here we will see very classical things. And here I would like to share a bit of my experience. Somewhere 20 years ago, calcium carbonate was supposed to be known as the most important and the highest elemental form of calcium. However, the researchers like Dr. Reddy's realized much longer before any one of us realized that it is not to do with the elemental form of calcium, but it is related to the absorbable form of calcium. And that's where I think 20 years ago, several companies launched calcium citrate, because they said it's not the elemental calcium, but it is basically the, the most important is the soluble calcium. They also realized that some of these calciums which are there, which are considered to be high elemental calcium, because of the effects that have been mentioned in terms of being non-ionized, are responsible for leading to non-absorption of calcium and certain constipating effect. In fact, one of the most important issues that is there, which I would like to reiterate here again, is that the acidity or the acidic stomach environment is responsible for ionizing these calcium, so that the calcium which is there can be absorbed in the duodenum, the jejunum, and the ileum by the active and the other transport mechanisms. However, it has been seen and it has been documented that achlorhydria, that is a decrease in acidity of the stomach, is a very, very common disorder in elderly population and even in a large population which is there in India. And therefore, that leads to lack of absorption of calcium and probably also some of the constipating effects of calcium, which are claimed to be high elemental calcium. So these are few of the issues, challenges that I'm mentioning about the current calcium formulations that are available. Next slide, please. So today, what we have been talking about is bioavailable milk calcium complex or ionized milk calcium complex. That's what we are looking at it. And I think enough has been spoken and emphasized by Dr. Reddy. However, I'll still take you to few of the things which are there. So next slide, please. Very interesting points here that I would like to bring in. That calcium carbonate is considered to be the highest form of elemental calcium. Because calcium carbonate was not the absorbable form, therefore people moved to calcium citrate, which had lesser elemental calcium. However, it had a higher bioavailability. However, today we have a milk calcium complex, which has got a higher elemental calcium compared to calcium citrate. At the same time, it is much more bioavailable, and it's a ionized chelated complex which contains a different other minerals. The minerals which are basically, next slide, please. The composition is calcium, magnesium, phosphorus, potassium, trace elements, and certain, dairy-related peptides and amino acids. Now, this is a very important part if you look at this composition which is there. And the composition of the bone, it matches exactly to the same way the composition of the bone is there. So what are we looking at? We are looking at a complex, ionized complex, ionized mineral complex of calcium, which delivers the same kind of composition that the bone has. And these are some on the right hand side. These are some of the mechanisms which are there. The minerals from the milk source help to enzyme functions. They form in bone formations. They help in water balance, maintenance, and oxygen transport. The peptides and amino acids also help for body functions and other kind of important aspects. So we are looking at a complex which is very unique, which has the complex which is not only has got a high elemental calcium, at the same time, it also has other peptides, minerals, and it is ionized, it is chelated, so that we can deliver the exact and the appropriate kind of content that the body needs. Next slide. I think this has been adequately explained by Dr. Reddy, and I don't think I can anyway re-emphasize the fact that it is ionized, it's chelated, it's got a special technique. So what we are looking at it is a product which is perfectly ionized and a higher bioavailability of all minerals contained from the milk sources. One of the most important part is that calcium is important. However, at the same time, some of the minerals like magnesium, which are taken or which are given, are also important, because deficiency of magnesium can actually lead to a lot of reabsorption of calcium from the bones, and that can accelerate the osteoporosis. And therefore, this complex with its unique kind of composition helps to maintain the homeostasis of the bone and the environment of the body in terms of the calcium balance. Next slide, please. Now, I would like to change the track and just a bit get to the evidence-based medicine. So we talked about the concept, we talked about physiology, we talked about pathology, we talked a bit about medicine. Let's talk about evidence-based medicine, because one of the things that I actually congratulate Zion for doing is promoting the evidence-based medicine, the evidence-based science behind the nutritional aspects of what we are talking of it. And that's very important to look at it. So this is a clinical trial which is there in published domain, which I would like to share with you in terms of this ionized milk calcium. It's, in fact, it has got it has been talked about anti-aging, the review and experimental clinical study of bioavailable calcium, probiotic and their effects on reversing osteopenia, osteoporosis, and other common and chronic health conditions. This is a community-based randomized clinical trial. So when we look at certain levels of evidence, this is a level 1 study. It's a comparative, or it's a community-based, it's a randomized clinical trial, 1,000 patients. This is very important. When you look at clinical trials, especially of certain nutritionals or nutraceutical supplements, it is in maybe few hundred patients, 50 patients, 100, 200 patients. Here, the study has been undertaken in 1,000 patients, which is a very, very important number. So the number gives you the kind of population that has been studied. The patient categories and the interventions they have been studied in is the mild osteopenia, severe osteopenia, mild osteoporosis, severe osteoporosis, age above 40 with osteoporosis, age above 40 with osteoporosis. And they have been given bioavailable calcium, dairy calcium, which is there, which are the different forms. Next slide, please. So these are the composition which is available of these formulations that have been given. And again, if you see, it contains a perfect kind of combination of calcium, phosphorus, magnesium, potassium, vitamin D3. It contains the probiotics which Dr. Reddy's were mentioning, iron, sodium, potassium, and soy isoflavones. Very important kind of a composition. Again, as I said, ionized chelated milk calcium complex, which is highly bioavailable. Let's see what are the results. Next slide, please. So what are the results saying? The recovery was based on symptomatic relief, less or no joint or muscle pains that were seen before sleep, with less pain and in middle of the night, and lesser pain with walking. What was the initial severity? Mild osteopenia, time for recovery 2 months. Severe osteopenia, time for recovery 3.5 to 4 months. Mild osteoporosis 4 months. Severe osteoporosis 6 months. So if you look at it, subjects above 40 years with moderate osteopenia reported excellent recovery with the use of this formulation. Around 60 to 75% of the patients recovered from osteoporosis based on the symptoms. Next slide, please. So again, to reiterate the symptoms, if you look at it, we looked at on the symptom scales, there was the side effects were minimal. The efficacy was there. So in conclusion, what the authors say, that a massive community-based clinical trial distinctly proved that bioavailable calcium has a significant effect in reversing osteopenia and osteoporosis, in addition to improving overall health and symptoms. One of the points that I want to reiterate here is that calcium deficiency is very common in India. We are taking osteoporosis has got a very big burden on the society, and we are taking liberal amounts of calcium, which is a traditional form of calcium. Even then, why is it not being decreasing? Why is the kind of, if I may call it as an epidemic, why is not there is no control on it? The question that comes to my mind as a clinician is that, are we giving the right formulation of the calcium that needs to be given? Are we giving the right constituents along with calcium? Are we giving the right ionized form? So the question which comes and which is being addressed here is that this formulation, this bioavailable chelated ionized formulation is giving you the best kind of composition that may be required to tackle this disease which has been there prevalent in the Indian community. Next slide, please. So to summarize, what is the problem? The problem is that calcium supplements either have low elemental calcium, GI side effects, mainly constipation, reducing compliance, less absorption, hence less bioavailability. And what this all leads to is osteoporosis, economic debilitating osteoporosis, cost on the society, cost on the individual patients, cost or basically also related to a quality of life, because when you have osteoporosis, you have weakening of the bones and you have fractures. And you can imagine if you cannot walk. What is the solution? Solution today, as I said, we have been giving the traditional forms of calcium. Still, we are not able to control osteoporosis. So what's the solution? Bioavailable ionized milk calcium complex may be superior in terms of higher bioavailability with added minerals and amino acids with ionized with chelation. What is this unique method that we are talking of? Again, calcium and other minerals and proteins extracted from milk source with unique fermentation and enzymatic process, spray drying using nanotechnology. Very important words for this. Efficacy. Taking bioavailable milk calcium in 6 months improves symptoms of mild and severe osteopenia and osteoporosis. Evidence, a large 1,000-patient community-based randomized clinical study. So that's the evidence that we have for this formulation. Next slide, please. And here, just to make a reference to it, all the kinds of available formulations that are there, calcium and vitamin D3, chewable tablets which are there with the label claims. We have calcium and vitamin D3, again, chewable tablets for adults. Again, we have calcium chewable tablets with L-lysine. So different kinds of formulations which are there with the different label claims which have been approved for the different indications, as you will see across the age group. This is a point again I would like to say. Calcium is required from the infancy to the older age group. And that is what is very, very important. I just would like to go to the last slide. One thing that I want to say is that this product, which we are talking of, comes with a lot of references. It's highly scientific research product, and it is, and as we say, proof of the pudding is in eating it. And therefore, this comes with a great deal of scientific and evidence backing it up for management of osteoporosis, osteopenia, and calcium supplementation. Thank you very much. Thanks for bearing me.
Thank you, Dr. Anish. It was really excellent and it's very crisp, and you really covered it in your short 20-22 minutes of presentation about it. And it's rightly said that right age, right nutrition, right start is very important. Calcium is a very important nutrient. It's required for various basic functions in our body, right from circulation, it's right from transmitting a message from the brain to the body to and circulation of the blood, as well as for the health of bone, muscle, and various aspects of the health. So it is basically a complete complex mineral for holistic health. This is something which is very important, highlighted Dr. Anish very elaboratively. We'll go to the next slide to see that this particular ionized mineral complex, the calcium complex, is not only manufactured, can be used for the manufacture in tablets, chewables, powder, syrups, but this can be also produced in innovative dosage forms. And this can be discs. And interesting, I personally, when I consumed it, I was very impressed with the disc format, So now the milk calcium can be made in the biscuit format, the buttons, in straws, calcium bars, shots, effervescent tablets, gummies, and for various functional food and beverages like the curd, milk, and all, etc. Now, the interesting point is about it. Your question would be that whether this is made by Xeon. What Xeon is also doing is, besides manufacture in-house with their dosage forms, they are also supplying in collaboration with GLN this particular interesting golden mineral, the ionized mineral complex, to various companies to manufacture this thing. So you can customize your products in these formats and take it in any form of it, in an innovative form of it, and customize these products. So this is something which is very interesting to know, that this milk mineral complex can be made in various innovative dosage forms. Next. Now to summarize the fun facts, what Dr. Reddy and Dr. Anish Desai, this duo has done a brilliant job. They come with a very strong background, an extensive background, especially Dr. Reddy, who has invented this, and Dr. Anish, who comes with a strong experience in the medical and the scientific area, has really proved that this ionized mineral complex is far superior in various aspects to the conventional calciums. And especially when it comes to the comparison with calcium carbonate, citrates, this stands very superior when it comes to an absorption, because it's in the ionized, chelated, and a nano form. It is a differentiated one. It is highly concentrated, and it provides a very good elemental, the calcium is bioavailable form of calcium. And especially Dr. Reddy mentioned and Dr. Anish mentioned, it's about the patients with comorbidities, especially with the patients, especially those geriatric patients who suffer with the comorbidities. And in case of COVID, as you said, the maximum number of deaths which are seen is observed is in the patient and individuals with a comorbid diseases. So this is very, very important to know that this particular calcium, the ionized form of calcium, is very safe to consume in a geriatric patients about it. And it also helps for the healthy microbiota and microbiome, which Dr. Reddy highlighted in his presentation. And this complex mineral is for the holistic health. So, the audiences, I keep this forum open to ask questions. There are some questions which has come for Dr. Reddy. Is very special question is like, why is milk calcium complex superior to calcium carbonate and other common calcium supplements about it? So, Dr. Reddy, this question is come from an audience to you.
Okay, could I answer it?
Yeah.
Okay. Yeah, that's a very, very good question. I brought it up earlier, but I'll enlighten. That's a beautiful question. Calcium carbonate, the reason you take any calcium supplement, irrespective of the age, is because you are deficient in it. Like, for example, as you age, as the hormonal status change, both in the female as well as the male. So these hormones, especially female hormones like estrogen, when estrogen level come down, the hydrochloric acid production is significantly reduced in the stomach. Okay, if it is so, your calcium carbonate needs tremendous amount of acid in the stomach. Okay, if it is not there, the calcium carbonate is not ionized. It goes in an insoluble form. It's an insoluble form, it goes to the duodenum. In the insoluble form, it's not going to get into the active transport system. Then it comes down to the ileum. That calcium carbonate is a powerful neutralizer. We got to maintain the acidic pH in the lower intestinal tract. If we don't do that, then you're going to end up with less calcium going in. On top of that, you're also going to have constipation, which is a severe problem right now. That is why the milk mineral complex has been pre-ionized, as Dr. Anish said and Dr. Sandeep Gupta said. This is chelated, pre-ionized, as well as made bioavailable with all other minerals with it. So that is why it is much, much superior to the pure form of calcium carbonate. Calcium carbonate is a single compound, whereas this is a multiple complex here. This is a complex, it takes care of all the problems. So I hope I answered that question for the calcium carbonate issue.
Yeah. So Harminder, can you just take off the slide so Dr. Reddy can interact face to face? The another question which has come from an audience is like, can you help understanding how does other minerals and peptides help in bone health?
Excellent. That's another very good question. This is where Dr. Anish brought it up, and I brought it up earlier too. Let's talk about the active transport system for calcium. It happens in duodenum. In duodenum. In duodenum, you got to have magnesium and phosphorus with it to push the calcium, the soluble calcium, through the enterocytes, because it's an active transport system. Active transport system means it is not physically pushed. It's not osmosis. Okay, it has to be done through the enzymatic systems, and also it has to be done with the cofactors. These cofactors are other minerals that will push that thing through that. That's why you need it. But it is in the passive transport system down there in ileum. You don't have to have cofactors, because as long as you have elemental calcium in there, it gets not to the cell, not to the enterocyte. It is between the two cells. Okay, through, that's what is called para transport system. Okay, that's a passive para transport system, not as it is not going to the enterocyte. That's why the absorption is very low at that stage. That is why all these cofactors, all these minerals, they help. In addition to that, in the milk mineral complex, we have all these minerals built in, and they're also made bioavailable. Okay, because even that mineral has to be bioavailable to help the bioavailable calcium, and that's all been taken care of. And the peptide, of course.
Doctor, what role does probiotics play in the? I request Harminder to take off the slides so we can have a face-to-face interaction. What role does probiotics play in the preparation process of this calcium?
Excellent question. Probiotics, if you look at the bacteria, okay, then you can ask me the question: why are the probiotics there to start out? It's a God-given gift to the humanity. Okay, these probiotic bacteria, they have developed a peculiar enzymatic system, and they have a plasmids. The plasmid means you have a chromosome that has several genes in it. These probiotics have extra chromosomal genes. They have a specific functions for those genes. Those are the ones that are giving you therapeutic effects in the body. What we did, to answer your question, if we took the milk mineral complex, we fermented it with the probiotics. These probiotics, when they ferment the sugars and everything, and whatever, even in the milk mineral complexes, they produce immunomodulins. Immunomodulins means they produce the nanopeptides, and they also produce bacteriocins, and also they produce non-specific inhibitory compounds. Okay, all of these compounds, when they go into the gastrointestinal tract, these products produced by the probiotics are the initial ones to activate your immune system. See, this is where Mr. Garg was talking earlier. Immune system. We need immune system. Immune system is controlled by the probiotics. So what we did in this mineral complex, we tried to create those immunomodulins of the probiotics, and they're also stable. Even if you heat treat them and spray dry them, they're intact. So when you take it, you're not only getting probiotic cell walls and everything, also you're getting intact immunomodulins. When you take it, it's also improving your immune system, in addition to this calcium absorption. That's why we built in the probiotics.
So, Dr. Reddy, there is another question which has come up just now on the chat. I said, apart from bone health, what other indication can this complex be formulated for?
So I gave you earlier a lot of things. Hypertension reduction. Like you said that, Sandeep, the comorbid conditions. Hypertension is one of them, and then you have the diabetes, and then you have all other factors. Okay, what else it will do? It will reduce the hypertension. It will reduce the loss of alveolar bone, because you don't have to keep on visiting dentists, okay? Because as you age, the alveolar bone, you lose the bone, because when the calcium is pulled out to the alveolar bone, the teeth get loose, okay? Then you have gingivitis, you have the bleeding in the teeth and all that. So those are the factors too. Not only that, what we noticed in patients, they get this horrible pain in the joints, muscle pains, joint pains as they age, because these things can also be cured with the calcium, because calcium participates in several things. Not only that, my wife is sitting here, she's pointing out to me, okay? Hair growth, because we gave this bioavailable calcium, Sandeep, you wouldn't believe it. The people complain one thing: we have to go to hair cutting too many times. Women especially, it's expensive in America, which is a good sign. excellent hair growth, plus skin complexion. Even for white people, they want that skin complexion. It improves that, and then the skin complexion, hair growth, and nail growth. Women love to have nice nails, okay? This son of a gun is doing it, okay? This is because this has multifunctional effect. The largest organ in the body is what? Skin. And the fastest growing organ is what? Hair, okay? In the body, every day we have to shave, right? This is what we're talking. So this calcium is indirect way of looking at it. The person is going to look very brilliant, looks very good, because all human beings are good looking, in my opinion, in their own way, okay? You see what I mean? This calcium significantly improves their looks, and it's an anti-aging. And as Dr. Anish said, prevention is better than cure. Okay, I like to see elimination of diseases in the world, because like in ancient Ayurveda, we had these things, we lost it. Okay, I hope I answered that question.
Yeah. And one additional question for you, just one question, last question, and then I know maybe a question to Dr. Anish. There is a slight concern. This question has come from a senior director, Mr. Samar Ghosh of Incurred, who has actually built up a good mineral brand in the country, like in India. He's mentioned that there is a slight concern of having calcium carbonate for prolonged use may increase risk of arterial stenosis. Being supplement, can this be a better alternative or to be taken with combination of vitamin K27 appropriately, specifically for heart patients as safety? He's asking specifically for the geriatric patients, those patients with the heart disease, how this can be superior or can be safer option over a calcium carbonate.
Excellent question. Again, calcium carbonate is not a soluble calcium. Okay, it's a very insoluble fraction. Okay, some part of the calcium, anytime you have more insoluble salts in the blood, your chances of depositing in the arteries. Arteriosclerosis is nothing but losing the elasticity of the bone, of the blood vessel. Okay, that's what is arterial sclerosis. This is what I mentioned earlier, Sandeep. Arterial sclerosis is because there are several factors in it here, okay? Now, this bioavailable calcium, when once it gets in with the biopeptides, okay, as opposed to the calcium carbonate, they tend to reduce the production of angiotensin II. Angiotensin II is the one that's causing irritation in the blood vessels. That irritation causes inflammation. Inflammation causes deposit of the calcium salts. Especially the insoluble calcium salt will deposit there, cause the arteriosclerosis. Okay, this is what we are finding in the COVID patients too right now. This is what is the thing. So taking the bioavailable chelated ionized milk mineral complex is far superior. It will not have that kind of problems. Okay, with the arterial blood systems.
So question to Dr. Anish is like, somebody mentioned the dairy. I think this question can go to Siddharth later stage. But Dr. Anish, how do you compare this calcium, the ionized mineral complex, we call as ionized chelated nano mineral complex with coral calcium? I think this question is something which, there is a market for coral calcium in India, though there are saturated, but there is a market for coral calcium. How this is compared with coral calcium? Dr. Anish?
Yeah, so I would just like to supplement one answer to one question which came in. Is many of the diseases which are there, one disease which is predominantly very common in India at this point of time is obesity. And calcium deficiency is very well known in obesity. So one of the additional pieces where it can have effect is the obesity part of it. So that's just a supplementation to what answer Dr. Reddy gave. Coming to your question about the coral calcium, one of the things that I very specifically mentioned is that the bone has a specific composition. And we need to supplement the calcium and the composition of the bone. And with this complex, we are supplementing that composition. However, with coral calcium, it is basically what happens is that it's a mineral. It's being sourced from certain artificial or certain with sources, which is still many times not known. So these are the issues which are related there. And that as can said, that these high levels of calcium which are there, unionized form, can cause a lot of side effects. Constipation being one of the most commonest ones. Lack of absorption. So it's like this. When I'm taking this coral calcium, which is high elemental calcium, the problem that is there, it's like wearing a non-ISI helmet, which people used to talk at some point of time. Yes, I'm wearing a helmet when I'm going on a two-wheeler. But is that really giving me the protection that I need? So the calcium that I am taking today, which is the carbonate form, I am taking it and I am feeling safe with it. Is it true? That's the question that I have, and that's the reason I presented with a lot of data, which talks about the bioavailability, which talks about the ionization required, which talks about the achlorhydria. So many patients are hypoacidic, and if the acid is not there in the stomach, the calcium is not going to be absorbed. Again, one of the things, as I said 20 years ago, why did calcium citrate came into the picture? Because this highly advertised or promoted coral calcium was not absorbable. So you require an absorbable, bioavailable, as in the first sentence, Dr. Reddy mentioned that what is bioavailability? You may take a lot of calcium, but is it getting absorbed? Is it being effective? That's what is the important part of it.
And to add to this, in fact, Dr. Reddy also mentioned that the absorption, the intracellular, extracellular, and plus he also gave a little the background on the microbiota and the microbiome. So Dr. Reddy probably here the Dr. Hardik Patak, who has asked this question, is about it. Even coral calcium is ionic form. How different is this? I think the probiotic addition and the peptides and plus your complex together make it superior to coral calcium, as well as the absorption, the intra and the extracellular. So how you relate this to coral calcium? I mean, further to add to this, Dr. Anish and Dr. Reddy, I mean.
You want me to answer that question? And then Dr. Anish summarized it well. The coral calcium, it has some of the calcium carbonate, it has some of the calcium oxide. Okay, calcium oxide is there. But in the coral calcium, you don't have these peptides, and also you don't have the soluble form of calcium. Okay, that is why it may be a little bit better than calcium carbonate. Yet, what we talked about is not one complex only. Like you take the calcium citrate, or you take the calcium carbonate, or something else. Okay, they're single compounds. Okay, but in my opinion, in the body we don't understand 100% how our body is operating. We're only hypothesizing, right, Sandeep? Exactly, that's the truth. And then so I would like to see calcium in different formats, different chelated compounds, mineral like it's calcium lactate, calcium gluconate, calcium acetate, calcium lactate, calcium, on and on and on. Okay, and same thing with all other minor minerals. We chelated them, as this you have indicated earlier. Because of that, there's no comparison to shell calcium, not the calcium carbonate. This is like way up there, and then these are down there. Okay, and then I'm not downgrading them, as Dr. Anish put it earlier. If you brilliantly said that, if we are taking the calcium carbonate all along, how come we never improved? What is if something is not working, there's a problem, isn't it? You see what I mean? This is why we are also joining the peptides here with the probiotic immunomodulins are there. Immunomodulin is also supplied in this complex because that is to increase the immunity simultaneously. Okay, that immunity has a lot of factors again related to the other comorbid diseases.
So,
okay, that is
Dr. Reddy, here also one more question is how important role in cancer, HIV, TB to immune calcium relations? Is it important for cancer, HIV, TB patients?
Yes, I can answer that. I just wrote an article on this on the HIV. Okay, let's talk about HIV. HIV is also an RNA virus. Okay, it has a lipid layer. Okay, just like coronavirus. Coronavirus is an RNA virus. Okay, and it has a lipid layer and it's a spike. You see an Indian TV these days, really nice looking coronavirus turn out like a jewelry piece right now. Okay? Sorry to say that. The jewelry piece, all the crown is the protein, and underneath is the fat layer. Okay, so coronavirus is very easy to kill out of all the viruses because if I bust the protein, that fat, it falls apart. Okay, now same thing with HIV. HIV also is RNA virus. What we have noticed, the medicines that are working on the AIDS virus are also working on the coronavirus. Now, what did I tell earlier? What did I say? In corona, we have two aspects of this disease. One is, first it's hitting the lungs, okay? And then it hits the alveoli. That's where the problem is coming. And then then second thing, there people can recover in the beginning. But once the virus gets into the blood, okay, this is where it's coming. Once it gets into the blood, then you are tough luck right now, because this virus attaches to the ACE2 in the blood vessels. In the blood, when it attaches to the ACE2 is shut. Once ACE2 is shut, the angiotensin 2 increases. That is what causes inflammation in the blood vessels and everything. Okay, that is where we are finding the bioavailable calcium and peptide stops the formation of angiotensin 2, which is the one that's causing the problem in the COVID diseases, because COVID virus attaches to ACE2 and blocks it. But even if it blocks it, this is unrevealing it. So that is why, to answer that question, a brilliant question, HIV virus is RNA virus. Coronavirus is an RNA virus. If this bioavailable calcium can help the coronavirus, yes, absolutely. It will help the HIV virus too. Okay, but as I said, these are all the hypotheses and that we can propose. And I'm very confident right now, this bioavailable calcium with the peptides, with the milk peptides, and it will stop that angiotensin 2. Angiotensin 2 is the problem when you block this coronavirus blocking that ACE2. Okay, this is why I'm very confident giving this milk. It won't hurt. Why not? You take it in a food or whatever it is, it will also help it.
Thank you so much, Dr. Reddy. We come to the last question. I bring this to Siddharth, and there was a question about the Dairy Cal Plus, that this is already existing in the market about it, how it is different. So Siddharth, you can answer this question.
Yeah.
Siddharth? Yeah.
So I would say that was a very good find actually. Whoever's found it was already you found the best product on the market. So it is made from the same raw material. It is our raw material. It's a company and a brand that we've been associated with for a long time. Dr. Reddy has been associated for a long time as well. So it is the same raw material that's used in that brand.
So thank you so much, Siddharth. I think that resolves or that answers all the questions on the chat box. And as much as possible, Dr. Reddy has really given a brilliant insight to this entire story of a beautiful story about, I would say it's a beautiful story. And today, the marketing companies, the health professionals need story to narrate. And this is an excellent story to talk, to discuss time and again and again, consistently, and make it a beautiful journey of an ionized mineral complex when you discussed amongst the health professionals. I thanks Dr. Anish also, who brought in a great insights with his expertise and wisdom areas. When he has worked on the other side of it as a pharmaceutical company, he knows how much this science matter, how much the clinical evidence based approach matters when it comes to nutrition. And today, calcium is one of the very important nutrient in the body, as it is involved for various basic functions in the body. Calcium is so important that it affects not only the women's life, it also affects the men's life, and at all the age group, right from all stages of the life cycle. It's so important in our body which acts as a carrier to carry out basic functions in the body. I thank everyone here, the elite panelists who are present here. I thank Suresh ji, who has actually taken an initiative on behalf of Xion Life Sciences, such an interesting scientific conferences, a series of scientific conferences he has been carrying out for during pandemic period, which is an excellent. I think it was not possible, for in a very difficult schedule of, when Dr. Reddy is placed internationally in US to bring such session physically. It's always excellent to have a face-to-face, a camaraderie while having a discussion on the science about it. But still, he made it from US, and thanks to this digital technology, we are all present here, equally as important as we are physically sharing the knowledge with each other about it. I thank Rani ji, who is present here, who always been a great support. I would say two women who has always been a great support to Suresh ji to drive Xion Life Sciences when it comes to the digital technology. Yashna has done a wonderful job, carrying out the invitations to the august audience who are present here. Thank you so much, Yashna. I thank Girish ji, Dr. Girish, who plays a very important role in the sphere of Xion while it comes to our product developments. And he has been working on interesting product development in various formats to present to the marketing companies, and will be available to answer all your questions post this webinar. Thank you, Shekhar ji, who runs after the entire operations of Xion Life Sciences. who help support the manufacturing team, the R&D team with all its wisdom and expertise on the shop floor, which is very important to take from product from bench to bedside. He plays a very critical role in the system, in the circulation of the entire operations. And thank each and everyone who is present here. Vinodji, who plays a very important role at the front end to interact with all of you. Always when it comes to the commercial aspects of it, you bring a lot of sense to the business as a team, a brilliant marketing team, a brilliant product marketing team. I'm thankful to all those team who at the front work together with the team at the back end, and all put together Xeon team brings promise for life. That is something which is very important, to all of you. Thank you so much for this insightful, interesting, the concepts which Dr. Reddy and Dr. Anish has beautifully put up. And I think this duo has done a brilliant job. And we all should thank to them that building this science approach, clinically based approach here. Thank you so much, Dr. Anish and Dr. Reddy once again. And thank you. And I thank on behalf of Xeon to each and every one, the audiences who were present from different companies. We will reach to you post webinar through emails, through messages, through phone calls, and we will send across the best of best information to associate with this particular beautiful product, which is a very unconventional, novel, differentiated process products, the ionized mineral complex, the milk calcium complex. Thank you so much for being here. Thank you to everyone.
I'll especially mention Sandeep. You have mentioned each and every person who has participated in this webinar. I would like to extend my special thanks to you for wonderfully coordinating the entire show, and my sincere and special thanks to Dr. Reddy, Dr. Anish, Mr. Siddharth, and of course, not to leave behind our MD, Mr. Garg. And Sandeep, you have been a wonderful host. Thank you very much.
Thank you so much. Thank you so much.
Thank you.
Thank you.
Thank you.
All done? Excellent job, guys. Very good job. Excellent presentations.
Dr. Reddy, thank you very much.
Thank you, sir. Thank you.
It's a pleasure. Looking forward to meeting you in person.
Yeah, sure. Very soon we will meet.
Just a minute. Just a minute. Okay.
Right, sir.
Yeah. All right.
Okay.
I
Bye-bye,
invite
everyone.
you to come and visit us in US anytime.
Yeah.